Hey folks, welcome back. We are at Sycamore Crossing here in downtown Blue Ridge. Beautiful Friday morning. We have Dr. William Whaley right here with us and Dr. Raymond Tidman. It's just time for Ask the Doc. Thank you, Georgia Cancer Specialist, affiliated with Northside Cancer Center. Just beautiful Friday morning, right?
Yeah, we come in here to the green room for makeup and everything a little bit early, so we were here when you heard the train.
Engines were cranking up everything.
And the whistle, you heard the whistle. Okay, at 8 o'clock, exactly, the whistle. But when you were going to the break, they missed the beer truck.
Oh,
the beer truck just went by while you were on break, so.
Well, we have
the beer truck.
We call it the sounds. You know what? The whistle used to be the factory in a small town. But we can talk about that at a different time.
Right, we don't need to. We're not getting into the politics of
I didn't say politics.
Sending jobs to first to South America and then to China.
See, he's the
and
one.
now to Vietnam and Bangladesh.
Wasn't me.
You want to hear them?
Huh? Hey, folks, every Friday morning at this time, we have these two great doctors with us, and Dr. William Whaley takes your questions, does so, I'm not going to just say some research, he does all the research, and we want to start with, you got a question, you got number one for us?
One of the things I wanted to, this is a lot about.
We have a tie, has a lot of fish on it.
That's my Christian tie.
Fish tie.
Yes,
Christian.
it is. All right. It's the week for my Christian tie. And my jacket, because it's Blue Ridge. It's chilly in the morning.
Chilly in the morning.
That's why you're up here. Look at that out there, folks. It's beautiful. This is going to bring up a bunch of stuff about weighing risk, weighing benefit, and not picking fly feces out of pepper, I used to say. I am worried about my husband, who has a kidney mass that is being observed for 36 months by repeat CT scanning. Well, that tells us right away that this was probably a very small cystic thing or something that nobody thought that operating on him or doing something big was worth the hazard of the procedure, because the radiologist doesn't want anybody suing him, right? So he's going to be very, very careful about how he reads that thing. And if he says reobserve in 6 months, reobserve in a year, then he's really pretty doggone sure that this is the right thing to do. And the doctor who's taking care of the patient is. Next one says, the one done in late 2019 said minimal change since prior scan of 6 months. So that tells you they're really watching him. Repeat in 12. Due to the COVID, that scan was not done until 2 weeks ago, so it was delayed by 6 or 8 months. The mass had grown to 2 centimeters. Okay, well, that's still quite small and has features of renal cell cancer. While working him up for surgery, a CT of the chest showed 2 spots, spiculated 1.8 centimeters and a second 1.9 centimeters. Now the oncologist, the primary care doc, sent him to an oncologist when he got that report of that nodule. Oh my goodness, is this kidney cancer going to the lung? What should we do next? So that was smart. Now the oncologist suggests biopsy the lung and wait to take out the kidney. What do you say? Well, Ray, what do you think I ought to say?
Lung's easier to get to, and you saw the word spiculated on it.
Yeah, I did. That's a bad word, isn't it? All right. Now the other thing is, I'm not sure that you're going to need to take the kidney out, but that would be what they would have on the table. All right. So show that first one. This is just what they did is they probably did a chest X-ray, and that chest X-ray, you got that up there? See that little bitty spot there? So the chest X-ray showed a little bitty spot like that. They went right down behind it and they did one of these scans. Now, if you look, now this is not too easy to see, and Jane told me we don't show them, they don't show too good. But if you look at this picture, this thing, all these will look different. Down to the bottom of them, they all look like strings and worms, right? And these all look kind of round. But when you see that one right there, see all those little things, those little hairs? Those are called spicules. Okay, pull that down. That's not a good thing. Now you don't have to show this for long.
Yeah, I wanted to because he zeroed in on that.
He did, didn't he?
Uh-huh.
He must be a doctor. What do you think? You missed it, but he didn't. Throw that up there, Emily. We'll just look at that for a second. Everything that's in the lungs, not cancer. There's 12 of these things sitting here, and only one of them is cancer. You can pull that down. Up here in the mountains, we see a lot of people who were raised on farms. Poultry's big up here. They've inhaled stuff over the years, and they have granulomas and spots on their lung. It ain't tuberculosis. It's living in a farm and being raised in a farm. Now, most of them are older, like Dr. Tidman and I. None of these teenagers we're seeing now seem to work on the farm anymore, so they aren't going to have them when they get old. All right, throw that next one up there. So we're going to make the assumption that this is going to probably be lung cancer, because that looks like lung cancer 90% of the time. So throw that up there. You've seen this pie a million times. There's lots of different kinds of lung cancer, but rather than take that thing out immediately, non-small cell lung cancer is that 40% block right there. You remember that? What does that mean? Small cell lung cancer, you can pull that one down, Emily, is everywhere at once. So if that thing's small cell lung cancer, you're going to forget the kidney. This isn't going to come out. The kidney isn't going to come out, and it's going to help you guide and direct what you're going to do. Next, we're going to assume that this is a early stage cancer that is not bigger than that, and there's nothing else on PET scan. Throw that next one up, Emily. You've got to have one of these every time, don't we?
Yes.
All right, so this is the survival, even of a small lung cancer, 70% at 5 years. Pull that one down, Emily. The next one is the survival of kidney cancer. If this kidney cancer is 2 centimeters, and it really is cancer, survival at 5 years is about 90%. So even if both of those are stage 1 cancers, the lung cancer has a poor 5-year survival, so you got to attack it first. So what's the story on that? You can pull that down, Emily, if you haven't pulled it down yet. So what's the right answer, Ray? Follow the oncologist's advice.
Well, yes, and the oncologist here has noted that even though they've been paying attention to this renal mass for years, you don't get distracted with that.
Right.
You have a cyst or something that's in the kidney and you're paying attention to it. Now, boom, there's something that's way more common and way more deadly up in the lungs. That's where you need to focus on, and don't get distracted or say, well, we've been watching this renal mass and that's got to be it because we've been watching it. No. So,
okay, now, another thing about taking care of patients.
Yeah.
So the guy's got athlete's foot and he's got dandruff, but he's got blood pressure and he's got diabetes. And he's more worried about the fact that he's got dandruff on his coat or that his feet are itching than he is about his diabetes and blood pressure. I'm making some sense?
Yes.
You've got to rank these things in terms of how severe they are or what they really mean. And people are more worried about, the face looks bad than they are about how bad their blood pressure is. Well, I said you might not have to take out the kidney. I don't want to go into this. But a small spot like that, historically that would have been take out the kidney. But now that we have laparoscopic and robotic surgeries, these guys are a lot smarter than I am, but at least they're a lot better with their hands than I am. But they can either ablate this thing by embolizing it. They might be able to resect a small portion of the kidney. So, yes, when they were talking about kidney cancer to you, the primary treatment is take out the kidney, but they really were saying do something about the kidney cancer, and it might be a lot less than taking out the kidney. Right?
yes.
All right, good. Now you got to ask questions about this because you always, you study these. I've sent you all of these all week long. Now you've been reading these at home before the day now, right? So you could ask questions.
No, I'm distracted by the city's music on a speaker.
Well, the guy that replaces you when you're not here, who has just entered the green room back there, he usually studies these things and then has a list of questions.
Do you feel put on the spot this morning, or
I can deal with it.
I want to know about that. I want to know about that pet of the week last week that lost 35.
Hey!
No, wait a minute. I didn't mean to. Did you hear that one?
I heard that's a hell
That's
of
a low
thing.
blow, isn't it? All right, ready.
So the city of Blue Ridge, I think on a speaker here, because I'm looking around, I think they have speakers all through town now. It might be a new thing.
No,
Everybody in town's listening.
no, they're not.
They got a
doing that.
speaker right there on that second story.
Somebody.
I think that's somebody up there just grooving to their coffee.
Oh, okay.
All right, ready.
Here I am. I got Alan Jackson in one ear. I got you asking questions and another. Let's go to question number 2.
This is a good question. This is a primary care question, and it's one of those things that looks terrible that ain't so terrible. All right, my wife has had 2 fairly big bloody eyes in 6 weeks that the ophthalmologist said were some conjunctival hemorrhages and were fairly common and were observed and not treated. Now that's, I'm going to explain why that's the right answer there. He asked how long it had been since he'd seen his PCP, and it had been before the COVID in 2019. The PCP found low platelets. Aha, so this really wasn't one of the spontaneous. 99% of these things are spontaneous, and they go away, you wake up, your eyes red, 4 days later it's better. But some of them aren't. So the ophthalmologist had enough sense to send the guy back to his PCP. So this patient went to the eye doctor first with a red eye instead of going to the primary care doc first. I think he made a mistake in doing that myself. The PCP found low platelets and sent him to a hematologist who found a big spleen.
Interesting.
And says he has cirrhosis and the spleen is taking his platelets. Can this be fixed? Well, there's a couple of things that aren't told in here that we'll have to guess at. One of them was, is the wife been a big-time drinker? Or is the wife maybe overweight? Because we got to figure out where that cirrhosis came from. Because, well, we know the spleen's eating up the platelets. The first thing, show that picture of that bloody eye. Now, you probably had it. I've had at least 2 or 3 of these in my life, and I'm older than you. But this is something that you see in a primary care doctor's office, I guarantee you, at least 3 or 4 times a month. Is that right?
Yeah, especially when she said to shut up and you thought she said stand up.
All right. No,
these guys are really on a roll this morning.
All right. This is called a subconjunctival hemorrhage. You got to show that big old chart.
You put the big chart up there right now, folks, at home.
There's a big chart. Well, I just don't want anybody losing his sleep over this. There are 2 types, spontaneous and non-spontaneous. Okay, pull that down. Most of the ones that wander in our office are people on treatment and their platelets are low, or so they've got a reason to do this, like this patient ultimately did. But the people who wake up in the morning with it, or who during the day
sneezed
notice it or something, I have a sneeze now, so the people who wake up in the morning, that's spontaneous. Go to this next one. Okay, this is not spontaneous. You see there, what the first thing came out of that PCP's mouth? Sneeze. What's the first one on the list? Sneeze.
Yes, I see.
I'll be darned. And what was the second one? Trauma. He was talking about the wife who said you thought you said shut up and she said stand up or whatever it was. Now, vomiting, weightlifting, constipation. Okay, you pull that down, Emily. So those are all the things that would make it happen. It'll make it happen to normal people, but it'll happen easier with low platelets. Okay, so throw that next one up there. So low platelets. Now, you remember what I said about being anemic, being low in platelets? It's as easy. There are only 3 mechanisms. You either aren't producing them, you're internally destroying them, or you're losing them. Pull it down. So the hematologist said, if you're not making them, then something's wrong with your bone marrow. If you're losing them, that means you're sucking them up in your leg somewhere in a clot. So these are being picked up by the spleen. Now, picked up that next picture of those livers, because this is something, I will say that most of the cirrhosis and big spleens that I see now are not related to alcoholism. Got up there? When I was in training, now remember I was in training 50 years ago, and I've been in practice for 51 years. Now most of them are due to metabolic diseases and things Ray treats, fatty liver and diabetes. You can pull that down. So I'm going to make the assumption that this patient didn't have an alcohol history, or the question probably, because it was a well-written question, would have mentioned it. So I'm going to assume that that patient's got an elevated cholesterol, was overweight, or had diabetes, and ended up with non-alcoholic cirrhosis and wasn't getting real good primary care. So if you just throw that next thing up there, they're 40 times, this is causes of cirrhosis, and alcoholism is the most common in history, but not now. And then you got hepatitis C, you got drug abuse, pull that down now. But I will say probably most of the ones that we're seeing today came out of fatty livers. Do you agree with that, Ray?
Yeah, it's an interesting, what your point about the evolution. Let me back up one other thing. So the patient who presents with the red eye, and we think it's a spleen or another issue that's maybe related to cancer, do you see petechiae in other places of their body, that is, other signs at low platelets at that time?
Well, it depends on how low they are. Yeah, okay. To get petechiae, they're usually below about 20. But to do something like this, they could be 50.
Yeah, more commonly now that we're paying attention to it, that they have a fatty liver from something else. We consider a fatty liver as an inflammatory response or an injury response. The body puts fat into the liver as kind of a protective mechanism. Later on, it scars down and becomes fibrous, which we call cirrhotic. Most commonly, even in my younger years, alcoholism was the most common cause of cirrhosis. Maybe it's a mental thing. I don't know that I've ever looked at the numbers back then, but when you see a cirrhotic patient, it's startling. It's startling. It's a hard place to go. So.
Well, but that thing we showed the livers had 6 of them.
Yeah.
Because we see most of these as a fatty liver and a fairly big spleen, and can this be fixed was the next question, right? Because I haven't finished there. So Ray just said it's an inflammatory reaction. The body's putting fat in the liver. Now, I want to go to another thing. If you won't accept fever as being a diagnosis, you want to say, well, why you got fever? Anemia is not a diagnosis. You want to know why you got anemia. Well, fatty liver is not a diagnosis either. You want to know why you got it. So can it be fixed? I'd say the answer is probably yes. If it was alcoholism and it was scarred irreversibly, it'll get better if you totally stops drinking, has a good diet, but it won't go away. But that big fatty liver, if you go get your diabetes treated, or you lose 70 pounds, or you get your cholesterol fixed, or whatever it was, right, Ray?
Right.
And fix that process, then it will get better. It may not go totally away, but it will get better. So I'm going to tell you that, let's go back to the guy that sneezed, lifted weights, and had the red eye. That's observed, you don't do anything, and it's not pathological. Now, you have 2 or 3 of them, you better go get platelets count checked and everything else. But basically, this is so common is that it is not, there's no way to treat it. Now, they might give you some lubricating eye drops or something, but basically it goes away. It
goes away on its own.
It's a bruise, but it's a bruise in a place that has such low tissue pressure that it gets bright red. If I touched your eye like that, it would get bright red. Nothing happens here because the tissue pressure is so low.
Well, let me ask you a question, because the picture you showed was a complete bloody eye.
Yeah, it's ugly, isn't it?
All right, but I've seen people just on the side, just
same thing. It's
exactly the same thing.
Yeah.
Okay.
Okay, it's just the degree.
It's got nothing to do with the amount. I mean, if it's completely in the eye.
Bill's point is it's a bruise, and the reason that it's so startling is it stays red. The oxygen is so able to penetrate that tissue that it keeps the red blood cells red. It keeps them oxygenated. So that bruise will stay red until the body heals it. So it can be the whole corner of the eye, a wedge to the eye.
Will it have pain?
No
pain. So if somebody says my eye hurts.
Ah, wait a minute. Stop right there.
Yeah, because that's
a painful red eye is a medical emergency.
Yeah.
A painful red eye
is a medical emergency.
Yeah.
Okay. All right.
And that's the easiest thing to remember. Well, let me say this: when somebody puts their hand on their chest like that and says anything, I'm short of breath, or blah 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 blah, that's 911. That ain't get me Pepto-Bismol. Yeah. This is Levine's sign. Chest pain's 911.
Yeah.
If you can remember that, remember a painful red eye is a medical emergency. Now, you might go in there and say, guess what? You got conjunctivitis from a virus, take these drops.
Yeah.
But you could have acute glaucoma, you could have all sorts of stuff. So
but just a bruised eye is just a bruised eye. Now, what about vision?
It does not affect vision because it's all around that.
Just
your
in the
cornea.
white of the eye.
Does
So-
not affect
So if you
vision.
get up and you have a bloody eye or blood in your eye, pain, vision, that's in a medical
That's a medical emergency.
Okay.
And you don't beat around the bush.
And by the way, call your doctor and talk to them about it.
Have you heard about
They'll
that
give
before?
you those answers.
What?
Call your doctor?
Yeah.
Yes.
Well, we were talking earlier. Ray's going to be here by himself next week. We're talking earlier that so many
driving.
so many people
I'm
don't
glad I have such advance notice.
so many people don't get routine medical care. And this first question here hadn't seen.
That's not my
PCP.
problem. Now you, wait a minute.
I
Now
wasn't-
you for years,
wasn't looking at you.
it's my turn now.
Okay.
For years, the two of them, and they know out there because we have the tape. They will throw little things out, and wonder. But my problem is not seeing my doctor. No, that's not.
You do to go now.
Okay.
I didn't say you followed all his advice, though. Never mind.
Just because I go.
Do you feel like a punching bag
I
this morning?
love it. It's what
All
I
right.
do, and I enjoy it.
All right. Well. All right. So.
Primary care physician, very important, okay? See your doctor. I like what you said earlier, the dandruff, because, that tends to bother me, but the dandruff and the itchy foot, not as important as the diabetes and the high blood pressure.
Correct. And
Prioritize, go see your
It's
doctor.
just like that, and that's
Exactly.
and then in cancer is that lungs thing. That
You have some great news on the screen there.
Well, no, I'm gonna let you tell everybody. What's the
3%. Positive rate, 3%.
Yeah, what was it you said when we were in the green room? Some state has had how many?
Texas this past week, I think, 2 days without a COVID-related death. Is that correct? Am I correct?
Yeah, you mean somebody didn't answer the phone, didn't collect the data, or you think the data's good?
Oh, no. I don't know.
All right,
Somebody forgot the chart.
Yeah, okay, so but that's the other thing. I mean,
He died. How'd he slip through?
we were
I'm
talking
sorry, I
last.
got
We were
jokes,
talking
sorry.
last week. California's rate and Florida's rates are about the same. And California's been locked down tighter than the dead gum drum, and Florida's got people down there playing golf and doing stuff. I don't want to get it. I got a question this morning, and they're asking me about 25 very important things for the school board in Pennsylvania about COVID, and it's about the same argument you were having about the Cobb County thing. And
Right.
the school board in Pennsylvania wants the kids in grammar school to wear a mask on the playground and social distance 6 feet. And they got a picture of them playing softball with the catcher and the batter in a mask, and the pitcher who's out there 90 feet from anybody wearing a mask. And they want me to try and give them some data they can take to the Pennsylvania board and argue with them about whether that's worthwhile doing or not. And Dr. Tidman would say,
No way.
I brought up this week on my program, I'm going to say 7th grade or whatever. You remember when we learned to do a study, and we were taught the process to do a study and document, every day.
Yeah.
We had different, you know what I'm saying,
Collect
right?
the data, yes.
Right.
Be accurate.
Collect the data, do a study, and what your outcome of the study, when you presented it, I don't know if it's 7th grade science or something like that. And I often wonder, in the real world, scientific world, how in the world are they doing a study when it doesn't even, you can't take the data in New York, apply it to the data in California, apply it to the data in Texas, Georgia, and what I'm saying?
Well, I'm not going to go on a rant about this morning, but I heard about a case, and when you hear these things as a physician, you're like, what in the world? So the case is a fellow that was scheduled to have a feeding tube, a peg tube put in, okay, and he had to go through a bowel prep and get all ready for it, which was fairly harsh to get his bowels all emptied. I'm imagining he's got some other serious disease that they're putting a peg tube in an adult male, which means they got to get nourishment into him for a long period of time. Shorten the story up a little bit. His wife called, because he's prepping over the weekend. He's going to go in for the surgery on a Monday. The wife called on Friday and said, well, now, is there anything else? Does he have to have a test for COVID? Anything else I need to know about? Because we're going to go through this prep, and it's harsh. No, ma'am, it's not. I don't see it on the orders. Call comes in Monday morning. He's all prepped. He's been miserable all weekend to go get his surgery done. And the nurse says, well, has your husband had a test? She said, no, you guys said I don't have to have it. And they go, well, we'll have to reschedule this surgery to next week. Now, you think that's just mismanagement. Okay, it could be mismanagement. Here's how bad it is. This man had COVID months ago. And this man recovered from COVID months ago, and he had so much antibodies in his blood that he donated antibodies for other people to get over COVID. There ain't no way in the world he can get COVID. He's better than immunized. He's better than anything. And they won't even ask that question to let the man go have gone through a prep to get a necessary medical procedure to save his life, because they're so rule-bound. They're so all absorbed with COVID in some hysterical fashion that they can't use their brains. This is a hospital. The standards need to be higher than that. For somebody to be doing a checklist and say, oh, you didn't have your test, therefore you can't have your procedure, therefore everything's delayed. That's how crazy this is, that our profession can let nonsense like that happen. Wouldn't you say, Bill?
Absolutely.
It's just beyond belief.
I'm in total agreement.
What I'm saying is, we're at a point now after last March, not last March 2020, when we started collecting data, and I listened to a parent go to the podium last night, address the school board, and say, my child was quarantined 4 times. I think, if memory serves me right, doing it 4 times. My child was out 50-some days, sent home 50-some days this past school year, never sick a single day. And now my child is behind.
Yeah.
And
Socially.
So I'm seriously, on a scientific level, I'm thinking, okay, where's the research that said, okay, we had this school system, 4,000 kids in this area, no mask, no quarantines, no teacher mask, no teacher quarantines, and we have this school system, quarantine, teacher wearing masks, students wearing masks. Where's the data that says, because everything I'm seeing
doesn't exist.
Well, not only that, Brian, I mean, we said this 9 months ago. We're individuals. We are individuals. We are not herds. We should not be treated like herds. Okay, we're individuals, and you have individual problems and individual situations, and you have supposedly intelligent people that can make those kind of decisions, and that's not happening. Oh, you're a herd. We're going to treat you like a herd, and you check that mark off, and you all get treated like 10,000 other people. They went back in California and published this last week. 2 major retrospective studies in pediatric hospitals. Retrospective means you go back and read the charts. Okay, children that were admitted in two hospital systems in California, looking at those who had, quote, COVID versus those who had COVID or were there with COVID. That is, came in with an appendicitis, did a COVID test, had COVID, got labeled as COVID, but they got treated for appendicitis. Okay, the percentage
or
of
gunshot wound.
Gunshot wound, car wreck,
yeah, right.
Brain cancer,
yeah, right.
Okay, terrible things. But if they had a COVID test, then they had COVID. Okay, in one system, the percentage of with COVID and not sick from COVID, 47%. The other one, 40%. Now get your head around that. Okay, so you have
that means
inflated
about
numbers.
half.
Almost half of the kids in these hospitals were, quote, there with COVID.
All right.
But they didn't have it.
Okay, now we're going to the news of the week. Now, he just did it. He just showed you that study is right here. But you asked why people do it. This is what really gets me. This is medical news, and it begins with the word Fauci. It doesn't begin with the word Fauci. COVID boosters likely needed within a year. Fauci. Yes. It doesn't say the New England Journal of Medicine has published this well-controlled clinical trial.
Exactly.
Exactly. They might be. They might be. I don't know. And he doesn't know. Fauci doesn't know either. But when he says, what does it say? Read it one more time. Read that word right there. What's the word?
Likely needed.
Likely needed. Okay.
But the media's running it like it just came out of the New England Journal of Medicine. It was published last week.
But they forget likely.
Yes.
They just drop it. Fauci says boosters will be needed in a year. Fauci's been doing likely, probably, and could be since day one. And you got to remember, likely, could be, and might be aren't data. I mean, look, we might get struck by lightning sitting here, but it's not very likely.
All right.
So, let me finish one other thing that Bill hit on that. You know, I talk about critical thinking and not just taking words and running with these headlines and stuff. In order to know whether somebody's going to need a booster 9 months out, you have to have people that are 9 months out.
And by the way, they're just getting there now, and they don't need a booster.
On test subjects. Okay,
yeah.
We're getting 9 months out on people who were in the trials.
Right.
Okay. Now it's not whether their antibody levels dropped.
No, it's
that
whether
may
they
be a
get
guess.
sick.
But are they getting sick? Ain't no way we know that. This is complete speculation.
Yeah, let me stop there right there. He said, wait a minute now, because he made a point there that absolutely is not understood by the public, okay? He said it's not whether their antibodies levels fall, it's whether they get sick. Now let's go to the real world. He and I came along at the time where blood-borne diseases and hepatitis B immunizations were beginning. And so medical professionals were first ones to get the shots. Before being deployed to Vietnam, military got the shots. It was a series of 2 shots, 6 months apart, right, Ray, or 3 months apart or something. And then at a year and 2 years, experimentally, they would measure antibodies. Well, I had my antibodies measured twice, and they were negative. Well, you know, I took a booster, and then a year later, they were negative. Well, what we really learned was the antibody level isn't important at all, because the immune cell in your body remembers the hepatitis B. So you can have a negative antibody, somebody sticks you with hepatitis B, bang, you go make the antibodies. So a blood level of an antibody is not equal to immunity to the disease. One more time. A blood antibody is not equal to immunity to the disease, because you have a whole other system of memory lymphocytes that are imprinted with that knowledge, such that when they see that antigen or virus, they go whoosh and make a bunch of antibodies. So we can't even listen. What he said was, even if the antibody levels fall, you don't know if they're not getting sick. They probably don't need you can't do that on 100 people. You got to do that on thousands of people. And if you remember, I just talked about the 8 New York Yankees who have been immunized that have the virus in their nose.
All right, I got 2 really quick things because I got a panel over here. They're ready to go. They're ready to go, but I got 2 quick things. One, is it the CDC director? Is her name Rochelle? Is that Dr. Rochelle?
There are several directors, but
okay,
yeah.
But
the
one on TV that we
That's
see.
right. The spokesperson
director. Mask off is gone. If you've had the vaccine and they're having a campaign where everybody's throwing their mask away, and if you've had your fully vaccinated, and a lot of people are saying, wait a minute, that information just changed overnight. Okay, and then there's people that say, well, wait a minute. If I'm fully vaccinated, I don't have to wear the mask anymore, inside, out, whatever. But what about I had COVID, I have the antibodies, I don't need the vaccine? I guess the only way to
consider yourself vaccinated.
Consider yourself vaccinated? Yeah. Okay.
Let me tell you why to wear the mask outside. I mean, when you go in the store. Did I tell you about the road rage?
Yeah, we went through that last week. I got the why. Now, one more question.
Well, if you're robbing the store too, you probably should wear masks.
Look at that car.
Wow.
That's worth stopping and looking at. Yeah. That doesn't go through town every day. That was worth it. Okay.
All right.
You didn't look?
No, I saw it. I saw it.
All right, one more, and we got to get out. Okay. They're saying, well, the CDC now is writing new guidelines. So my question direct: send the kids to summer camp, no mask.
Yes.
Send them off?
Yes.
So if mom's out
I would dare the summer camp to injure my child.
but there are summer camps that are requiring masks.
Yeah.
So if
I
you're
think it's not. I think
if
it
you're a
makes no
mom
sense.
out there, because this is a big question, a lot of responsibility on this one. If you're a mom out there and you're wondering, should I send my kid to a summer camp, no mask, and just like go enjoy camp? Would you send your kid?
Here's the way if I was advising a summer camp operator, I would tell them, look, if you're going to make the rules that says you're going to protect this child, and you're going to make the rule you wear a mask, and a child gets COVID, it's now your problem. If you say to the parents, be adults, these are your children, send them, have them wear whatever they want to wear,
Right,
it's
there
the
you go.
family's problem.
That's what he said. Now let the kid, let the mama decide if the kid should wear a mask.
Final word. I got to get out for the panel.
Well, it's a new sport in the country.
It's a new sport. Okay.
You know, they've got more and more drones flying around, and we got a lot of people that bought guns and stuff recently. And so I think the new sport is that you can shoot the Amazon drone, and it comes with prizes.
I liked that one.
Yeah. How long did you work on that? How long did you practice the delivery?
He practices
Make sure,
those.
Right.
He practices those.
Comes
Hey,
with prizes.
I was going to ask you.
What?
You got too much of your hair cut off. Wait a minute, because Dr.
Yeah,
Tibbet
look.
and I go to the same hairdresser,
Yeah.
and I am going to pay for the hairdresser to get you back to where you were with the longer hair, because my wife took pictures of your hair and gave it to my hairdresser to tell her to cut my hair like yours.
Bill, he's going
So
to
you
the
need
place
go
where
back
he
to
gets
this.
the gossip news. Come on now.
This is supposed to be an Ask the Doc segment.
It was.
Stay
This
off
is-
the. Let's not go to haircuts.
This is pick on Brian Day, and the panel is going to finish up for us.
Wow, I love it.
Donate
And
blood.
I love it, and thank you so much, Georgia Cancer Specialist, affiliated with Northside Cancer Center. We thank you so much for the segment. Great information with these two doctors every week. And don't forget, you can always go to FYNTV.com, FYNTV.com, and you can see Ask the Doc there. All the segments are posted. Share them with your family and friends, and you can send us messages at any time. Info at FetchYourNews, Ask the Doc, get the questions to him, and we always have these segments posted immediately after we're done. Great information. Thank you very much. We're going to take a break. We're in downtown Blue Ridge this morning at Sycamore Crossing. We're going to take a break, and we've got the All-Star Political Panel coming right after this.